Good afternoon, Dr. Arun. We'll start with the introduction first. So our admin head, Sharmila, she'll start with the introduction and then we can go further for the session, sir.
Right. So when you do this introduction, tell everyone to scan this barcode.
Right,
We
sir.
have some interactive slides, maybe about 5 or 6 slides.
Right,
So
sir.
they can answer the questions whenever the slide comes over on the screen.
Done, sir. I'll just inform them, sir.
Sure.
Good afternoon, everyone. Sharmila this side from Hello Kids Head Office. It's always my pleasure to connect with you all. Today, we feel honored and privileged to have with us a highly respected expert in critical and palliative care, Dr. Arun Kumar Sharma. To start with, allow me to introduce his remarkable achievements and profile. Dr. Arun Kumar Sharma is the director of the Medical Intensive Care Unit and a distinguished critical care specialist dedicated to delivering evidence-based, compassionate, and patient-centered care. With a strong commitment to clinical excellence, patient safety, and ethical practice, he believes in providing dignified and humanized care during life's most critical moments. An ACLS certified instructor, Dr. Sharma actively trains healthcare professionals and the community in BLS, which is basic life support, first aid, and advanced cardiac life support, empowering individuals with life-saving skills through this leadership, education, and unwavering dedication. He continues to advance critical care medicine while inspiring a culture of excellence, empathy, and continuous learning. Today, he will be guiding us on a very important and relevant topic, which is child safety and first aid. Handling fits, choking, and life-saving CPR, which will be helpful for parents, teachers, and owners in emergency cases. Also, so please join me in giving a warm welcome to Dr. Arun for his first Hello Kids live webinar. Over to you, sir.
Thank you, Sharmila. I think you're able to hear me out and you can see my slides. So thank you for your kind introduction, and thank you, Hello Kids. Thank you, our media and marketing team from Fortis Mohali, for giving me this opportunity to talk about a topic which is so very important. So as you already put forward in the introduction, I serve as Director, Medical Intensive Care Unit, and we treat the sickest of patients in our hospital. Well, I've been as of now involved in care of critically ill adult patients, but then during my career, I have had the opportunity to treat children with illnesses and with injuries. And over the years, I've realized that the outcome of these illnesses or injuries in children are always better if somebody provides first aid during the initial part of the injury or the illness. I've kept some of the slides using the Slido. So these would be interactive slides. I would request the participants to put forward their options whenever these slides come over. And for next about 30 to 40 minutes, I'll be talking about some important illnesses and injuries, medical emergencies, which we all can help reduce the impact. So I'll start with my presentation. We all know children are curious and they are prone to injuries and illnesses. While learning first aid is important, what is more important is to prevent these injuries from happening in children. So what would we cover in this presentation? For the sake of definitions, when we say first aid, we are talking about the interventions which are done before the child actually reaches the hospital. So this would be interventions which are done by non-medical persons in the community in the case of a life-threatening medical or a surgical emergency before the expert help arrives. For the purpose of this presentation, we'll be exempting the adults. We'll also be exempting the newborn babies. So when I talk about an infant, we'll be talking about somebody from the age of newborn outside the labor room to about 1 year of age. And an adult is when somebody has development of underarm hairs, pubic hairs, and development of breasts in females. What would be essentially covering in this presentation is the basic principles of first aid. You would have heard that before you try to help someone, the first thing that we need to do is we need to ensure our own safety. Let's say somebody is lying in the middle of the road and has sustained an accident. You wouldn't start giving first aid in the middle of the center of the road. Somebody is sustained an injury in the middle of a fire. You wouldn't start giving them first aid in the fire. So you would try to move them, ensuring your own safety first. The second important principle of first aid is that we should not do any further harm to the person who's already injured. While first aid is important, and as I said earlier, prevention is the key as far as children are concerned. During the course of my presentation, I'll be talking about this position, which is called as recovery position. This position is so very important after you've taken care of the emergency, because this position ensures that the person's airway is open, the person has comfortable breathing, and in case somebody vomits out, it is going to come out and it's not going to soil the lungs. Safety begins at home. So this would mean that we need to provide safe environment for our kids. So for example, in our kitchen, ensure that there are no hot utensils or hot liquids within the reach of children. You should ensure that the medications are kept safely, especially the disinfectants, which can be really poisonous for the children. Never leave a child unattended in the bathroom. You should have anti-slip mats. If there's a tub or a filled bucket, ensure that the children are not exposed to that. Never place high chairs near the railings because that would increase the risk of fall. In a bedroom, you should have the furniture which should be properly anchored so that there's no risk of fall. There should be no loose cords. There should be window guards. As far as it is very important that every child should know how to swim. But if you're going to a swimming pool, always ensure that there is constant adult supervision, and you should always use life jacket in case somebody doesn't know swimming. While prevention is important, we need to be aware about these emergencies and how should we take care of these emergencies by rapid assessment and giving evidence-based first aid. So I would be talking about certain medical emergencies, surgical emergencies. We'll also be talking about how to manage a child who is in cardiac arrest. So how do you give CPR? I would be covering my presentation in what is to be done, what should not be done, what are the myths, what are the reasons why we do certain things and do not do certain things, what should be done once the emergency has been handled, and how do you seek medical help. So this is my question number one. If you've scanned the QR code, I would request you to
Scan.
They're unable to scan. Has anybody been able to scan actually? No? Abhi, they're not able to scan. So should I just continue with the presentation if you're so
Yeah, it's scanned. Yeah,
you're
I
able
can
to
scan
do
it.
so correct. So I, as of now, have got 2 responses, 3 responses as of now. Any more responses? So what is exactly happening over here? Technically, we call this seizures or convulsions. Sorry, I have difficulty in moving my slides. Okay. Right. So let's try to understand what is to be done, what is not to be done. When we talk about seizures, these are uncontrolled movements which are happening in the muscles, and this would be a result of an abnormal activity in the brain. The first and foremost thing that somebody needs to do is stay calm and note the time of seizure, because this is something which the doctors are going to ask you when you reach the hospital. Now, when the child is having an abnormal contraction of the muscles, they're always prone to injury. So this would mean that if there are some hard objects or a furniture close by, you should take away those sharp things or heavy things so that you can protect the child from injuries. We did talk about recovery position, so it's very important that you try to turn the child onto their sides, which would mean that you can turn them on either on the right side or the left side. It may be difficult when the child is actually having a seizure, but can easily be done once the seizure is actually over. There are certain very important do nots which we all need to understand. Please do not put anything in a child's mouth. The reason is, if you see, when a child is having a seizure, there's a likelihood that he or she would be strongly clenching their teeth. And if you try to put, let's say, a spoon in the child's mouth, it's only going to result in further injury. It is not going to help them out. You should not try to stop this movement by trying to restrain the child. See, if you restrain, it's not going to stop the movement unless the activity in the brain gets over. In fact, trying to restrain the child can only result in further muscle injury or bone injuries. When the child is actually having seizures acutely, there's no point in giving food, water, or medication unless they are fully awake. There's no reason or rationale of splashing water or making them smell onions or shoes. Well, you need to call up emergency if the seizures do not settle down in next 5 minutes. If the child, this is the first seizure for the child, if the child has actually injured himself while he or she was having seizures, if the child is turning blue, or if the child has difficulty breathing. So if any of these things are happening, you should immediately call the emergency. Our next question. A child comes home running with blood dripping from the nose. What should you do?
Forward means backward and
So what should you? Should you keep the child's head backward or should you keep the child's head forwards?
Backward, I
Backward.
guess. Backward.
It will be a backward.
I
Okay.
think backward.
Let's try to understand what is right and why. So, epistaxis, as we technically medically call this term, when somebody is bleeding from the nose. So when a child is having epistaxis, it is going to be frightening for them, and most probably you'll see that they'll be crying. When they're crying, it is going to further increase the blood flow and it is going to cause further challenge. Now, there are certain very important things with that you need to do. If your child is having bleeding through the nose, which is epistaxis, always make them sit upright with the head forwards. And there's a reason why you keep your head forward. You want the blood to come out rather than go in. So if you make the child lie down or you keep the head backwards, this would mean that the child is going to swallow the blood which is supposed to flow out. This can further result in vomiting or choking, and it is never recommended. The next most important thing which is recommended is we need to pinch the soft part of the nose using your thumb and index finger. You need to apply consistent pressure. And during this time, because you've actually pinched the lower part of the nose, encourage the child to breathe through the nose. I'll again say, never put the child in the lying down position or the head backwards. Stuffing the nose with cotton or cloth is not going to help. There's a tendency to check every minute whether the bleeding has stopped or not. That should not be done. In fact, if you've collapsed the soft part of the nose, you should continuously do that for about 10 to 15 minutes. Once the bleeding stops, you should tell the child not to blow through the nose, not to pick the nose. When should somebody seek hospital help? Let's say the bleeding doesn't stop in next 15 to 20 minutes. This means this child should be shown to a healthcare professional. Let's say epistaxis has resulted because of facial injury. You should show this child to hospital. If the epistaxis is related to a foreign body on the nose, you should definitely see a specialist. If the bleeding is very heavy and you see that the child is actually getting faint, you should definitely seek the hospital help. So I hope we are very clear why the head needs to be kept in the forward position and not in the backward position. Let's look at another question. A boiling hot cup of tea falls over a 3-year-old's chest and arm. What would you do next? I'll continue with my presentation because I believe the Slido is not working. So the most important thing that we need to do is move the child away from the source of heat. The second recommended thing is we can carefully remove the hot and wet cloth, but we need to be very careful that if the cloth is actually adherent or stuck to the underlying skin, never try to remove it. we need to hold the burned area around cool running water. Do not use ice cold water or ice. It's simply, I'm very clear when I say it has to be cool running tap water for about 20 minutes. What we need to do is, what we want to do is, we want to keep the temperature lower so that the thermal injury doesn't worsen. Um, we cover the burn with clean dry cloth, but should never use something like a cotton because that is going to get adherent to the raw area and the child is going to have further trouble. You could give certain simple pain relief medications like a paracetamol or a ibuprofen. And but again, when I say so, I would say one needs to be aware about the age appropriate dose. There are some certain important don'ts which should be carefully considered. One, as I said earlier, we should not be using ice or ice cold water. Two, we should not be using our traditional conventional things which we've been practicing at our home, like applying haldi, toothpaste, or other things. If the thermal burn results in the development of blisters, do not try to puncture the blisters, because once you puncture the blister, the raw area is going to get exposed and this is going to predispose the child to further secondary infections. You should always seek medical help if the injury is a simple thumb rule is that if the thermal burn is more than the size of hand of a child, then you should seek medical help. You should seek medical help if there is significant pain and swelling. You should seek medical help if the child develops any other symptoms which include fainting or respiratory difficulty. Asthma, we all know, is a medical condition where the person has difficulty breathing because there's narrowing of the airways within the lungs. It could be result of an inflammation, or it could be a background inherent clinical condition where a child has an asthma. So in all these conditions, if you see that the child is unable to breathe, so if the child is a known asthmatic, they would have an access to their medications, which we call as nebulizers or inhalers. So let them sit comfortably. Do not make them move. Help them take their medications. If you think that the child has significant difficulty in breathing, you see that they are actually turning blue. So this is the time where you should immediately call for emergency help and take this person to the hospital at the earliest possible. An abrasion would be a simple erosion of the topmost layer of the skin. It can result as a result of a fall or something. The simple intervention that you need to do is simply clean this area with soap and water. If there is dirt, you can try using a soft cloth to remove the dirt over this area. Never try to use cotton because that is again going to get adherent to these areas and will be difficult to remove. Simple thing which is needed is to use soap and water or a clean water to clean these areas. Sprains are common, and the basic protocol that you need to use if somebody has sprain is a RICE protocol. So R stands for rest, I stands for ice application, C is compression, and E stands for elevation. These four things should be done if somebody gets a sprain for any reason. Let's look at another clinical condition. A child sustains a cut from the glass shard and the blood is pouring out from the forearm. What would be your first action? You would wish to wash the wound, apply pressure on the bleeding area, apply pressure above the bleeding area using a tourniquet, or apply ice pack. Any answers?
Wash
A,
wound.
Wash
A,
wound.
Wash wound.
Option number 1.
Okay, so let me try to reason out what would be the most appropriate intervention. If somebody is actively bleeding after a cut, the most important thing that we need to do is to prevent further bleeding. We need to control the bleed. A general convention is that whenever somebody is bleeding, we try to put a tourniquet above the area of bleed. So let's say somebody is bleeding for a forearm, the convention would be to maybe put pressure over the arm. But what we need to understand is our aim is not to stop blood flow to a bleeding area. Our aim is to actually apply pressure on the bleeding area. So if a child sustains a cut from a glass and blood is pouring out, when I say it's pouring out, our aim would be to put pressure over the area where the bleeding is occurring. There's no point in actually putting pressure above the area of bleed. Let's talk about fractures. So how would you know if somebody is actually sustained the fractures? So there'll be injury, there'll be somewhat of swelling happening, there'll be bruising. There's also a possibility that the limb may be lying down in an abnormal position. So when somebody sustains a fracture, the child would be in severe pain, and there's further risk of exacerbation of injury, because the sharp edges of a bone can cause further injury to the areas around the bone. So what needs to be simply done is reassure the child. You need to use a splint. It could be a simple wooden plank, and you should apply this plank in such a way that it covers a joint above and a joint below the area of suspected fracture. So for example, if there's a fracture in the leg, middle of the leg, the splint should be such that it should cover the ankle and the knee joint. If you suspect that there's a fracture at the level of the thigh, the splint should be such that it should cover the hip and the knee joint. What we need to understand, as we said earlier, was when you're helping somebody by providing first aid, our aim is to help them and to provide secondary injuries or secondary harm. So if you try to move this person who's having a fracture, there's a possibility that abnormal movement can cause further injury to the associated or the surrounding structures in the leg. So splinting is the simplest and the most important thing which needs to be done in case a child has sustained fractures. Let's look at a snake bite. So there's a teenager who's bitten on the ankle by an unknown snake. These are certain things which we think about or we see happening in the movies or in the telesoaps, cutting the wound, placing a tourniquet, trying to suck the venom, start running, or simply keep the child calm and reach the hospital. Let's try to understand why certain things are important. Scientifically, 70% of snakes would be non-venomous and 30% would be venomous. The snake venom hurts by causing either massive bleeding or causing paralysis. By paralysis, I would mean that the child is unable to move. The child would have drooping eyelids. Child would have difficulty breathing. When I say the venom causing a bleeding complication, this could mean that there's a bleeding happening from the eyes, there's a bleeding happening from the nose, there's a bleeding happening from the mouth, or there's a bleeding in the urine. Now, what we need to understand is the answer for a snake bite is taking a child to the hospital and giving them anti-snake venom. What is the first aid that you can do? Child lie down calm, keep calm. Do not make them walk around, because if you make them walk around, this is going to cause further absorption of the venom. Immobilize the bitten limb. There's no scientific evidence to say that the sucking the venom helps, because in fact, what if somebody sucks on the venom, even that person who's trying to help can get predisposed to the effect of the venom. There's no point in cutting on that particular area thinking that if the blood is let out, the venom is not going to spread. There's no point in massaging that area. There's no point in placing the tourniquet. In fact, again, if you place a tourniquet above the site of bleed, you are actually decreasing the blood flow lower down, and that can actually cause compromised blood flow and cyanosis, or the limb turning blue. So the answer is very simple. If the snake is non-venomous, which you would not know, there is nothing which is going to happen to the child. But if the snake is venomous, the only thing which is going to help them out is taking the child to the hospital and giving them anti-snake venom injections. Let's try to look at this condition. A 12-year-old is eating peanuts and suddenly he stops talking. He clutches his neck and cannot cup. What would you do next? Would you give him water? And any answers from the participants?
Yes.
Yes,
What would you do?
Water.
Any other answers?
Don't give him water.
You'll try to give him water.
No.
Don't give him water.
Yeah.
Pat on the back.
Pat on the back. Fantastic. Anybody else? So what we're dealing over here is we're dealing with choking. By definition, choking simply means that there's a foreign body which has gone into the person's upper airway. The upper airway is the area which we call technically, scientifically as trachea. And since there is a foreign body in the upper airway, this person will have difficulty breathing. Now, management of a choking person would depend upon the clinical condition of the person, the age of the child, and how severe is the choking. What we need to assess is, let's say there's a child in whom you suspect that the child may be choking. The first and foremost question that you need to assess is, can the child speak or cough? If the child can speak, or can actively cough. This means that the choking is mild. In this situation, you would simply request the child to cough, to keep actively coughing so that the foreign body can be expelled out. The second scenario would be severe choking, where the child is unable to speak, the child is unable to cough, and you see that the child is making a universal choking sign, which is clasping the throat. You also see that the child is having difficulty in breathing and they are turning blue. Now, in this situation, we would need to use an age-appropriate choking first aid. The third condition is, because we know that there is a foreign body in the upper airway, there's a strong possibility that if this choking is not relieved, this can further cause a decrease in oxygen in the body, and this can lead to a cardiac arrest, which is the heart stopping. So if a choking victim becomes unconscious, this would be a condition where the heart may have stopped because of a reduced oxygen in the body. And in this situation, we will need to give CPR to this child. We will talk about CPR a little later, after 5 to 10 minutes, but we need to understand that there are certain rules which we need to follow. Can you mute everybody else, please? Right. So we need to be aware about certain very important don'ts. As somebody said, we'll give them water. There's no point in giving them water because this is a child who's unable to breathe, and giving them water is only going to complicate things. There's a foreign body. Unless and until that foreign body comes out, the child is not going to get better. The second important thing is, do not try to make blind finger sweeps. There's a tendency that, this person has swallowed something. Let's try to take the foreign body out by sweeping through the mouth. We need to understand that the foreign body is not in the mouth, it's in the upper airway, and there's no way you can actually remove it by using a blind finger sweep. In fact, blind finger sweep can further complicate the situation, so do not do that. So if it's a mild choking, simply encourage the child to keep coughing, and if it is severe choking, we'll now learn the maneuvers of how to relieve a person who's having a severe choking. Okay. So this is a video which talks about how to relieve choking in an infant. Remember, when I talked to you, infant is a child up to the age of 1 year. So let's see what needs to be done. You need to hold the child in such a way that the head should be, you need to sit down, hold the child in such a way that the head has to be lower than the upper body. And we need to deliver 5 back blows and 5 chest thrusts. Let's see how.
2, 3, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
So this technique is the one which we need to use in a child who up to age 1 year, which we call as infant. So we simply use 5 back slaps and 5 chest thrusts. We continue this until the time the foreign body comes out or the child becomes unconscious, which would mean the child would now require cardiopulmonary resuscitation. Let's look at a situation where a child is choking. The video actually shows an elderly person, but the technique would be similar. So let's look at this video.
Perform 5 back blows using the heel of your hand and forcefully strike the person's back in between their shoulder blades. If back blows do not relieve choking, perform 5 abdominal thrusts. Your fist with your other hand and press your fist into the person's abdomen with a quick, forceful upward thrust. Give each new thrust with a separate, distinct movement. Continue alternating 5 back blows, followed by 5 abdominal thrusts until the object is dislodged or the person becomes unresponsive.
So if the child is more than 1 year of age, what we need to do is, this is called as the Heimlich's maneuver. So it's a combination of giving them back slaps. So we give them 5 back slaps and we use 5 attempts at the Heimlich's maneuver, where we hold the child in such a way that we clasp around the lower part of the chest and we give upward blows to help the foreign body gets expelled. We need to understand that once you've used this maneuver, even if the choking is being relieved, you should definitely see a healthcare provider. Do not try to give them food. Do not try to give them liquids. Do not make them lie down. Simply use this maneuver to relieve choking. let's look at the most severe situation in the list of emergencies that we've come across in this presentation. A 10-year-old suddenly collapses during a football match. How would you react to this situation? Any answers? What would you do?
First, take him to the open area.
First, take him to the open area. Good. Anything else? See, the golden rule of providing first aid is that you need to make an assessment. You need to find out what is actually happening. If a 10-year-old child suddenly collapses, it could be a simply vasovagal, or it could also mean that this child has had an acute cardiac arrest. Now, let's try to understand what is cardiac arrest. While it may not be important in a child, but just to make you understand, let's say there is someone, an adult, who says there's a severe chest pain the adult is experiencing a severe chest pain. Now, this chest pain could be an indicator of a heart attack, which is obstruction to the blood flow to the heart. Now, we need to understand a person with heart attack is going to be conscious, complaining of chest pain, but a person who's in cardiac arrest would not be conscious, would not be breathing, and would not have a pulse because the heart is stopped. So the reason I'm giving you an example is because we are now would be discussing what we need with what we consider as cardiac arrest, a condition where where somebody's heart has stopped, and we would also be learning the technique of cardiopulmonary resuscitation. So C is cardiac, which means heart. P is pulmonary, which means lungs, and R means resuscitation, which means that we are trying to revive somebody whose heart has actually stopped beating. So first and foremost, as I said earlier, we need to make an assessment of the situation and try to find out what is actually happening. So if you come across a person who suddenly collapsed, you make an assessment, you try to find out whether they are conscious or not. So what you would do is you will tap them, you can call their name, and if this person does not respond, you need to simultaneously check whether this person is breathing or not. How can you check breathing? You can simply, look for the airflow. You can keep your finger beneath the person's nose and look for the airflow, or you can actually look at the chest, whether the chest is moving upwards and downwards or not. When we teach this course in the hospital setting, we talk about three things. We need to ascertain that the person should be unconscious, the person should not be breathing, and there should be no pulse. However, we realize, and science realizes, that looking for a pulse for a non-medical person would be difficult. So if you come across a situation where a person is unconscious and not breathing, that's a situation where there's a strong possibility that the child or an infant or an adult would have sustained a cardiac arrest. The first and foremost thing that you need to do in this condition is to immediately call for help. You should have an emergency number in your phone, a local hospital number or a local ambulance number, which should immediately call up. If you've clearly ascertained that this person is unconscious and is not breathing, so this means that this is the time you need to give them CPR. I would also wish to clarify that you would have all seen chest compressions. The chest compressions are basically done to ensure that the blood flow to the body is maintained. We all know that the heart beats continuously and provides blood flow to the entire body. Now, this is a situation where the heart has actually stopped, and until and unless we press the heart to ensure that the blood keeps pumping through the body, the person is going to have organ damage and is not going to survive. So again, first principle, if you see somebody is in cardiac arrest, first ensure scene safety. That means you should see your own safety, ensure that you do not become a victim of while trying to help somebody. You need to place the victim on a firm, flat surface, face up. We need to ensure good quality chest compression. So what is good quality chest compression? First, we need to learn the techniques. We need to keep our hand, the heel of our hand in the center of the chest, at the lower part of the breastbone. We should not keep our hand on the right side or the left side, because if you keep your hand on the right side, you will end up breaking the ribs. If you keep your hand on the left side, you'll again end up breaking the ribs. If you keep your hand low down, which is the area of the stomach, and you press that area, the person is going to vomit and is going to further soil the lungs, and you will end up causing more damage. So the technique is important. Your hand should only be in the center of the chest. the compressions that you need to give is about 100 to 120 per minute. Some of you would be aware about a compression ventilation, universal compression ventilation ratio, which is 30:2. So when an adult has a cardiac arrest, we normally teach that the compressions only can suffice. But in children, the arrest usually happens as a result of a respiratory condition. For example, we've talked about choking, where the airway is blocked and a drop in the oxygen requirement is actually resulting in a heart stopping. So giving breath to a child or an infant is very important. So if you're helping a child or an infant in cardiac arrest, you can do two things: either provide continuous high quality chest compressions, or if you know or you can give breaths, we should give 30 compressions and 2 breaths. The technique of compression we've already talked about is keeping your hand in the center of the chest on the lower half of the breastbone and compressing to a depth of about 5 centimeters. And you should do it continuously. I would also put forward that there's no point in giving the compressions at a lower level. Let's say somebody says, I'll give it at about 60 per minute. There is somebody who would say, the heart is not beating. Let me give the compression at 140 per minute. There is enough scientific evidence that says that the good outcomes have only been seen if the compression is done at the rate of 100 to 120 beats per minute. The chest compression has to be done to about 4 centimeters in infant and to approximately 5 centimeters in children. We should always let the chest come back. See, what we're trying to do is, now somebody's heart is stopped. When we press, the blood is going to flow through the body, through all the vital organs. When we release, the heart again fills up. So we need to, while the compressions are important, letting the chest come back and letting the heart fill up is equally important. And you should minimize interruptions. There's a general myth that if CPR leads to, breaking the ribs, it would cause more harm. But we always tell in our sessions that it's better to have a live victim with broken ribs rather than not doing CPR. Let's try to see the video and try to understand. Let's just look at this video. This would help you further have a better understanding of what cardiopulmonary resuscitation is.
We explained how to save lives with CPR. This is Maria. Her friend Peter has collapsed and his heart has stopped. Maria is shocked. She has called an ambulance, but what can she do in the meantime? Maria has seen heroes save people in the movies, but how does it work? If the heart stops and the brain doesn't receive oxygenated blood, there's danger of brain damage. Cardiopulmonary resuscitation is an emergency procedure for keeping oxygenated blood flowing around a victim's body. Cardio means heart in Latin, and pulmonary involves lungs. Unlike in films, it isn't intended to restart somebody's heart. That usually requires an electric shock from paramedics. CPR involves repeatedly compressing the chest by about 5 centimeters at a rate of around 100 beats per minute in order to replace the heart's rhythm. Maria could also breathe into Peter's mouth or nose, though this isn't as important unless you're a trained professional. But there are some complications for Maria to keep in mind. Tearing of the liver can occur, as can bruising of the lungs. Rib fractures are relatively likely, but much better than the alternative. Without CPR, Peter would likely die. Maria is relieved that she now knows what to do and can increase Peter's chances of being revived. The ambulance arrives quickly and successfully saves his life, thanks to Maria's efforts. With CPR, you don't need to be a hero to save lives.
So let's try to understand the difference in the technique if you're doing CPR for infant or for an older child. If you are giving CPR to an infant, you would need it if you look at a condition where the child is not conscious and the infant is not crying or not breathing at all. The technique which is recommended for an infant is either a thumb encircling technique, where you use both your hands to encircle the chest, and the compressions again need to be given at the same rate, about 100 to 120 per minute. Let's look at another technique which can be used in a similar infant.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26,
I told you, what needs to be done is we give 30 compressions followed by 2 breaths. Giving breath in an infant is not very difficult. You need to put your mouth, which would, if you put your mouth over the infant's face, it will cover both the nose and the mouth, and you need to give normal breath, and you give 30 compressions and 2 breaths. Let's look at the technique of cardiopulmonary resuscitation in a child.
Place the heel of one hand in the center of the chest on the lower half of the sternum. It doesn't matter which technique you use, as long as you are able to provide deep, effective compressions. The depth of compressions will be slightly shallower for children because their chests are smaller. Your compressions must go to a depth of at least 1/3 the diameter of the child's chest. That's approximately 5 centimeters. The rate for chest compressions is the same for adults, children, and infants, which is 100 to 120 per minute. Now let's talk about
drowning. Can somebody tell me why death occurs in drowning?
Water goes in the lung.
Water goes in the lung. Anything else? Do you think we can take out water from the lungs to save this child? Or let's say what we normally see in our movies, pressing on the abdomen and the water coming out of the mouth and child surviving. Do you think it makes sense or that's not right?
It's not right. It has to be pumped out via instrument, I guess so. I don't know. I'm picking a guess.
So let's try to understand why death occurs in drowning. I would say it's not related to water entering the stomach or water entering the lungs. So what is happening is when somebody who doesn't know swimming, if drowning occurs, they would not be able to breathe. So when they're not able to breathe, this results in decrease in oxygenation in the body. And if there is a consistent decrease in oxygenation in the body, this would result to stoppage of heart, which is again cardiac arrest. So how do you help a drowning victim? So let's say you notice that somebody is drowning. So what we need to immediately do is pull them out. You cannot give CPR in the middle of a water. So you'll pull them out, you'll make an assessment. If the child is conscious and breathing on its own, you'll simply put them in a recovery position. But if the child is unconscious and not breathing, now we know that this is a situation where somebody's heart would have stopped. And the only thing which is going to work in this case is giving CPR to this child. Now, in this case, because the cardiac arrest would have happened because of a drop on oxygen in the body, it is very important to give breaths to a drowning victim. So as I told you, you should ideally follow the technique of 30 compressions and 2 breaths, and this should continue till the time medical help arrives. If there's a reason that you cannot give mouth-to-mouth breathing, then at least cardiopulmonary resuscitation, CPR, chest compressions should continue till the time medical help arrives. There are certain don'ts which we all need to follow. There's no point in pressing on the abdomen or pressing on the chest to take out water. Nobody dies by water going to the stomach. And it's a myth that you can actually take out water from the lungs and the child would survive. The only thing which would work in this situation is effective chest compressions. Let's talk about this. As we were growing up, we all felt that home is the safest place for all of us. But today, home is also not a safe place. We have internet, which gives us so much to learn, but at the same time, internet is flooded with a lot of problems that we as parents now see these days. There is cyberbullying. There are so many things which can be troublesome for a growing child. So what I would suggest is, as a parent, you should always set age-appropriate screen time limits. You should keep screens in shared family spaces. Teach children never to share personal information. Use parental control and privacy setting to limit access to inappropriate content. You should always monitor your child when they are, gaming online or using social medias. You should always have open conversations. So, for example, if a child talks about cyberbullying, they talk about inappropriate message, you should always address it. Another important child safety point is mental health emergencies. And I think we are already sitting on a mental health emergency pandemic. Today's Gen Zs are not resilient. And mental health emergencies are something which is usually forgotten. So if you observe that the child is becoming suddenly withdrawn, there is extremes of behavior, there are panic attacks happening, or there is either an episode of self-harm or there is a suggestion that child may harm themselves, please hear them out, reassure them, and seek medical guidance. This is my last slide. The right action taken in first few minutes can save a child lives and prevent lifelong disability. Thank you so much for your patient listening. Thank you.
Thank you, sir.
Thank you so
Thank you so much, sir.
Thank you, sir.
Thank you, sir.
Thank you. If somebody has any question, we can maybe you can put it in the chat box, or you can raise your hand and we can have one-on-one interaction. Let me see the questions. Somebody has asked a question about skin allergy. I think skin allergy would not be an emergency, so I would suggest please see a skin doctor. And it's only if somebody can actually evaluate and see what is the problem, then an appropriate treatment can be given. How to?
Come down the screen time.
How to come down on the screen time? You'll have to take care of your child. You'll have to observe them. You'll have to ensure strict discipline.
Just want to ask if the children is so much anger and I want to control that anger. So what can help you immediately to the my child, because he is very angry at small things. So how can handle the tantrums of that?
See, you cannot control the temporary tantrums by rebuking them or saying. You'll have to hear them out. You'll have to understand why these anger issues are there, and if those anger issues are not solved, then I think you need to seek help of a clinical psychologist. That's the safest thing that I would suggest you should do. But first and foremost, it will be you'll have to hear them out and try to understand why those anger issues are there. If the child is putting a coin in the mouth, it is not going to harm them. Even if the child swallows the coin and it goes into the food pipe, it doesn't create any acute emergency. The emergency only happens if that coin goes into the upper airway. But if child has swallowed the coin, you'll have to go to the hospital and seek help from either a gastroenterologist who can safely remove the coin. If the child is 4-year-old and has been having cough, see, most children in the age group of 1 to 4 year will have the common cold. A common cold actually does not require any significant interventions, and medication in this age group are usually avoided unless and until the child develops, let's say, significant breathing difficulty. Otherwise, simple observing them, taking care of their fever, basically supporting them with hydration is the only thing which is needed. If you think that it is troubling the child, then you should go get in touch with the pediatrician and use the medications. If the child chokes while crying, I think this child would require evaluation in the hospital setup. You wouldn't be able to give any first aid except from keeping them in the recovery position, which I just talked about.
Severe food allergy reaction, anaphylaxis.
Anaphylaxis. So, see, allergies can be simple allergies where you see somebody developing a hive or a redness. Anaphylaxis is a severe form of allergy where somebody develops breathing difficulty. There is swelling around the eyes. There is swelling around the face. You tend to hear a lot of whistling sound coming from the chest. In the Western world, there is a thing called EpiPen, which is epinephrine pen, and in emergencies, or somebody who's known allergic, so they usually keep those pens with them. In India, we do not have an access to those pens. So in case somebody develops severe anaphylaxis, immediately call for help. Take this child to the hospital at the earliest, because there won't be much that you'll be able to do at home, except for maybe keeping them in a recovery position, nothing else. But please do not waste time. For a child who's having severe anaphylaxis, take them immediately to the hospital. See, first aid also means that you should be aware about these signs where you need to seek medical. It doesn't simply mean that you'll always be able to take care of the child at home. It also means being aware that this situation can worsen and this child should be taken to the hospital before things worsen further.
Sir, I want to ask one question.
I think you'll have to close you using multiple devices. Please switch off one device.
Sir, am I audible now?
Actually, I'm not able
Hello.
to hear. Yes, please.
Sir, I want to ask that if a child is continuously crying, so he or she forgot to take breathe, right? So at that time, what we need to do?
See, children, there are certain children who would hold their breath transiently, but this doesn't happen continuously until it is a seizure. If it's resulting convulsion happening, then you need to go to the hospital. Otherwise, it's a simple crying spell. It will go by itself. You don't need to do anything. Vasant, you've raised your hand. Vasanta.
When the child is crying, sir, that time they are getting the vomiting also. What we have to do, sir? Control the vomiting, sir.
See, put them in the lateral position. The basic principle of first aid is you should not let further harm happening. So if you put them in a lateral position on the right or the left side, even if the child vomits, that is going to come out. So
Okay,
if you
sir.
make them
Okay,
lie
sir.
down like that, the vomiting can go in the lungs and that can cause further problems.
Crying time they get the vomiting, sir.
That's perfectly normal. It won't harm
Okay,
them.
sir. Okay, sir. Thank you.
The
Hello,
child
doctor.
slips and develops an injury on the chin. You just need to simply apply pressure and stop the bleeding. And stop the bleeding first. Take them to the hospital. They'll do an X-ray and try to find out if there is a bony injury or it's just a simple injury.
Hello, doctor. In case there is any fire mishaps or burns on the kid, what do we do then?
See, if the fire causes injury by two mechanisms. One is the heat, and second part is the smoke. So, as far as the heat part is concerned, we did talk about a very simple condition where a hot liquid had fallen over the child. But if it's an actual burn, the important thing is to put that limb under tap water. Do not try to remove the clothes because the clothes would be adherent.
Okay.
The second most important thing, if it's a fire, for example, it's a fire in the house, while you're ensuring your own safety, you need to pull that child out of that area and then provide first aid. The first aid would again depend upon the clinical condition of the child. If the child is conscious and breathing, you simply can put them in the recovery position. But if the child is unconscious, not breathing, this could mean that the child may have sustained a cardiac arrest, and then you will need to do a cardiopulmonary resuscitation, which is CPR.
Nobody does this, no? Okay, doctor. Thank you. Doctor, one more question. How about if the child bites another child? And what is the precaution we need to, not precaution, what is the action we need to take on?
Human bites.
Biting, a child biting another child severely.
Whom do we want to help? The child who's been bitten or somebody who's biting?
Bitten. The child was bitten.
So you need to see
We
at
need
home.
we need help on both the ends. Yes.
Yes, you need help on both the ends. For the child who's been bitten, you need to simply clean the wound with soap and water, at least with water. That's the first and foremost thing. If it's a clean bite, you may not do anything, but I think it would simply mean that you're going to clean it with water, take them to the hospital. They would maybe apply an antiseptic and clean the area.
All right.
And they would make an assessment how dirty the wound is. If the wound is clean, then there's nothing much can be done. If the wound is unhealthy, then they will probably try to remove the unhealthy part. When I say remove the
All
unhealthy,
right.
clean the unhealthy part.
Okay. All right. Okay. Thank you, doctor.
Thank you, Chin.
Hello.
And related to this, doctor, how do we remove the biting habit of the child who is into biting? Though we tell them, though we stop them, suddenly it triggers. So how do we stop it actually?
I'm sorry, but I don't think I'll probably be able to answer this question. I'm really sorry.
Okay, doctor.
Yeah.
Thank you.
Yeah.
We have to give a tetanus injection in this case.
See, again, giving a tetanus injection is a question which I'll give you a clinical knowledge about it. So tetanus is something which is given early during the childhood, right? And then a booster is to be given every 10 years. So as far as the role of tetanus injection is concerned, it said that if the wound is clean, it could be an injury, it could be a bite. The tetanus booster needs to be given if the last booster was given more than 10 years ago. But if it's a dirty wound, then if the last booster was given less than 5 years, then you need to repeat it. So for a clean wound, a 10-year would be fine. But for a dirty wound, you would need to repeat if the last injection was given last about 5 years.
Okay. Thank you, doctor.
Yeah. So if there are no further questions, can we close the session? I hope I was able to uh, create awareness about certain common myths, and we could reason out certain things which are actually important. And there was some change in our perception of how emergencies need to be managed. And I hope and wish that this session would empower you to be an important component in the chain of survival that we talk about. Thank you.
Thank you, sir, for delivering such an insightful and impactful session. On behalf of entire Hello Kids family, we sincerely appreciate your valuable time, sir. Thank you so much, sir, for joining us.
Thank you so much. Thank you for your patient listening. Thank you.
Thank you very much, sir.